Hi, it's Dr. Wendy at wendyshower.com. Today this video blog is going to be about the hip. And this is for people who are just starting to get hip stiffness and maybe some soreness, not full-blown pain and limping, because I don't think you probably would be able to do this, but you can try. So what I'm going to show you is what's happening with my hips just because of my 22-year career as a chiropractor. I had to think of how long I've been in practice. 22 years. And they're starting to get really stiff, and I do not want to have a hip replacement by the orthopedic surgeon. So this is my prevention so that I can keep going in my career and not have surgery. So I'm going to show you two sides. My left side is much better than the right, even though both of them aren't perfect. So what I'm going to have you do is you're going to go on your back, and you're going to bring one knee to your chest. You're going to see how far you can go. My patients who are ready for hip replacement, they can get to about here and that's it. So we want to make sure that you've got good flexibility. So as I bring my knee in, I can feel a little pinching in the front of the hip joint, but this one's not too bad. I can bring my hip up. Now on the right side, as I bring it up, I'm starting to get pinching here already. And then as I move in, I've got a lot of the pinching pulling in the front of the hip joint here. So this is the side that I'm going to show you what to do, the stretch to do. So you can see sides. My left side, I can come into this position, I can have my leg here, and I can do this stretch. If you're a yoga person, I think they call this the pigeon pose. And what you're going to do, I'm going to kind of angle around, is we're going to work like stretching in here, the inside of the joint, and you're just going to kind of roll around, like grinding the joint out, getting that joint capsule that's getting really fibrotic and old in there, getting it to open up. So that was my left. And then when you see the right, when I go into this position, you can see how my leg doesn't come this way. So what I'm going to do is I'm going to force it into that position, and I feel it immediately in the hip joint. So I'm just going to come down, and I'm going to start trying to open up that hip joint. And this isn't going to be fun, but surgery isn't fun either. So we're going to work it out. And I'm going to go through many angles, just kind of trying to open up that joint capsule. And you're going to feel it stretch in the rear end. And it may be painful, it may be achy, maybe it's going to be tight. So you just keep working it. So I would do this however long I could do it, a minute or two, and do that every single day. So that's your homework. First check on your back and see which knee can come up and come in and which one can't. You're going to get on the floor and you're going to start opening it up. Have yourself a great day. Happy stretching. I'm just going to keep here working on my hip.